whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Cherry Live. I'm Dr. Jordan Valrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about Canadian healthcare. Join us as we speak to innovators, industry leaders, and people working to drive the health system forward. Today we're talking to Walter Yuan. He is the co-founder and CEO of Empathia.ai, which is a new AI scribe tool geared at helping clinicians improve their efficiency and their workflow and get the job done quicker so they can get home to their families. Walter, thank you so much for joining us.
Hey, Dr. Jordan, good to see you again, and thank you for inviting me to be on your show. And I really have been looking forward to this. And thank you for the very kind introduction. And maybe I'll just share a little bit about myself quickly. And so by training, I'm a microbiologist and bioinformatician. In the latter part of my graduate school study, I specialized in studying DNA sequences and both gene encoding and non-encoding regions to predict their functions and their expression patterns. After completing my grad school at the University of Wisconsin-Madison, I began my career at Caltech and UCLA, managing their experimental social science and behavioral laboratories. So I did a career switch. And after spending maybe just over a decade assisting basic research in behavioral science and developing experimental software, I left academia to fund an edtech startup called MobLab. And the thesis behind MobLab was to bring, learning by doing and learning by experimentation to the teaching and the learning of the social sciences, similar to what we have been doing for centuries in the natural sciences. And now the platform has been used by thousands of high schools, colleges, and universities worldwide. And fast forward to the beginning of last year, I teamed up with a group of AI computer scientists and product engineering leaders and physicians to launch Empathia.ai, aiming to provide clinicians with this intelligent medical assistant, as you just alluded to at the beginning of our talk.
Run into each other at numerous functions across the country on multiple occasions. I've never actually heard the serial entrepreneur kind of backstory. How carry over, from the biology world and dealing with genetics like that, into more of that like commercialization of technology and then now into the realm of AI? What was the crossover?
Yes, when I was recruited to run the behavioral science laboratories, and I think the pitch was that they hope to have someone with interdisciplinary training. By definition, bioinformatician, and you have to understand biology and, especially the low-level DNA sequences, protein structures, as well as a bit of statistics and computer science. And so I think from that switch, that widened my view of how science should work and can work. And then what I see in laboratories is that we run experiments for the social sciences, even though on the teaching side, it's all talk and talk. So it inspired me to say, can we emulate what we have been doing for centuries in the natural sciences, where we learn by doing experiments. We run chemistry experiments, we run, mutations, we work with E. coli, and we do all these things. And so I left academia to say, okay, can we build an educational technology company to bring experiments to classrooms across the social sciences? And so I think that's when I started doing more startup entrepreneurship work. And then I think it was late 2022 when ChatGPT took the world by storm. And I remember writing an internal memo to the team and by telling my colleagues that we need to embrace AI. We need to embrace generative AI, this new wave of technology disruption, probably more significant than any of the waves that came before it. And so we started exploring technologies, and then one thing led to another, and here we are, and Empathia.ai.
Where did the physician focus come from? Because that definitely seems like a little bit adjacent to the fields you were previously in. Why did that demographic rise to the forefront of your...
Right. We took a rather unusual path. I know we have, colleagues from other AI, Scribe AI technology companies that they often come from a physician-led angle. And I think Empathia has taken a slightly different path. At the beginning of last year, we started, as I mentioned earlier, we started exploring AI technologies. And then the one thing that the team started developing is this high fidelity voice to text transcription. We were thinking about use cases in classrooms, on social platforms. So we perfected this technology where we can take a long conversation and transcribe it into high fidelity, high quality transcript. And voice to text has been around for years, if not decades. But what we did is that we blend in AI technology and we put context into consideration. So the transcript is very accurate. And then we started looking for use cases. And so we got this hammer and we're looking for nails. And so as I started talking to more and more of my friends and colleagues, and inevitably I ran into physicians because of my biology background. And back when I was in college, half of my friends are pre-med. And so a lot of my friends are practitioners. And so once I started talking to them, it's just couldn't be more salient that documentation is such a pain point for clinicians across the board. And I would say, the number one epidemic for clinicians is burnout. And then the primary cause for that burnout is documentation. And so we decided, okay, let's go tackle that.
Honored to be one of the nails that you guys are trying to get at with your hammer here, because it certainly is like one of the biggest challenges in healthcare right now is just that administrative burden and how much time gets wasted doing behind the scenes, and especially when it comes to the charting. And so the application of the AI powered transcription into the medical sphere, I mean, it's just entirely revolutionizing what I do as a family physician and what I've been hearing from my colleagues too across the country, and just how it's transformative to their practice.
Absolutely. I mean, physicians across the board probably spend over 40%, if not more, time on documentation. And we try to figure out creative ways to be more efficient. I see physicians, typing constantly while they're talking to patients, and some use their, after visit time to dictate. And but nonetheless, all that distract you from paying attention to your patients. And I think this is where AI Scribe or AI technologies in general could really help.
Focus that you guys wanted to put forward with Empathia. You had your tool, and then coming to the market with the actual practical application for it. And this was the niche you landed in. And how did you guys actually want to differentiate yourselves? And what was the main focus, I guess, in putting the product together? I know you've got a bit of an eye for, just product. What was the main focus for the company in general, not just for yourself when you came to putting this all together?
Right. It's difficult. When we started working on Empathia, we quickly recognized that, if the pain point is such a salient pain point, there must be dozens of teams have already recognized this opportunity. And sure enough, even when we started working on Empathia, we already know both in Canada and US, there are startups or even major players that have been investing in this direction. And I try to think about and how we differentiate, or at least how we can augment our competitive advantage. I think of a few different dimensions. Number one is stability. And we simply recognize that the mission critical nature of using AI Scribe in patient care workflows, and to ensure our technology operates in as robustly as possible, including offline reporting. And so if the network connectivity is lost at your facility, as long as you use our app to capture your encounters, all recordings will be uploaded and notes will be computed once the network is restored, or you move to an area with internet connectivity. And the second is personalization. And we want to build an intelligent assistant capable of learning, adapting to individual preferences and expertise. The more you work with Empathia, the more Empathia evolves and contributes to your practice. And number three, I really hope, and it's my dream, to build this exceptional medical summarization platform for physicians, and whether covering long consultations, capture nuances specific to specialties, and documenting pertinent active information. We're handling multi-language encounters from French to Punjabi to Chinese. And she just delivers this medically compliant pre-charting notes. And last but not least, I think startup is all about team. And I think particularly in this field, working with physicians, I think trust and team matter greatly. And since day one, we have understood that for physicians and clinicians to incorporate something like AI technology, this black box AI technology, particularly AI scribing, into their daily practice, trust is crucial. And having a panel of practicing physicians on our team and building a responsive and professional customer success unit and putting in that ground level effort in the field, as we talked about when we met, and collectively help us build trust and relationships with our customers. And since last September, I have visited hundreds of clinics across Canada and US and worked with thousands of clinicians. I'll continue to lead by example and encourage my team to just stay as close as we can to our customers and be there for them.
Focus on the customer success unit, because right, this is like pushing into new ground, right? We're entirely uncharted waters here when it comes to healthcare and the augmentation with AI. And so you initially get that wave of the early adopters that are coming to you that are a little bit more tech inclined and computer program oriented, right? They're going to be
tolerant.
A little more. Yeah, but then you've got this giant backlog of clinicians who are just frustrated and burnt out, and there really is that strong push to try and start using these AI tools just out of necessity. And so I imagine you guys have to deal with a lot of just like making sure that the onboarding is good, the usage of the platform is smooth, that people are getting the most out of the actual tool itself.
Absolutely. I think, education and onboarding is such an important aspect and of adopting, especially a new technology like AI Scribe. And we spend a fair amount of time making sure, at least at the early stage, even though it may sound not that scalable, but at the early stage that we build relationships, we work with physicians either in person or in a virtual environment to make sure that they fully appreciate all the features we offer, and then the functionalities, how they work, what are the limitations, how can we instill this trust but validate attitude. And I think all these things collectively ensure the success usage of Empathia.
The conversation with those 1,000+ doctors go, what did that do to actually inform the product? Because what was this? A couple months ago, you were in Calgary on your way, like doing the cross-province tour, just visiting clinics and talking to more physicians. And that's something that I don't see most tech company founders doing, is actually getting down into the mud and interacting with the users. What did you learn from that process and all those conversations that you had?
I think on the one hand, in my past 10, 15 years of developing products and working in the startup realm, I've never come across a product angle that really sells itself. And the moment I mentioned that this technology could help physicians, could help you with documentation via clinical voice capture, I think physicians, clinicians just immediately understand what I'm talking about. This is not something that they have to change their workflow. This is not something they have to go out of their way to use. It's non-invasive. It just intuitively blinds in with their existing workflow. You don't have to change how you talk to your patients. Just do your normal conversation. You can go back and forth. Patient can mention another issue, and even though they may come with a particular cheap complaint, and if the technology is developed correctly and is truly intelligent, it handles all these situations gracefully, but still in a non-invasive way. So when I give a demo to physicians, I think, in the end, they just see how this thing works in a very natural and non-invasive way. And it's an easy sell. But then the concern comes to, how do we govern patient privacy, data security. How do regulatory bodies from the top CMA to the provincial bodies like CPSO, CPSA, how do they embrace, AI technologies in healthcare or AI scribing in particular? And these are the tougher questions that we have to address.
The initial just awe wears off. And I would say that that's like an accurate action for most people
Right.
when they engage with one of these tools. Like I'm just looking back, this was 2 years ago, maybe, or maybe a year and a half ago. I was at a conference, a medical conference, and saw a demo for an AI scribe tool, and like my jaw hit the floor. It's like, what? Like the computer will do that for me. It doesn't
It's
take
truly a
any
magical
effort.
moment. Yeah.
Yeah, oh, I know. And then downloaded it ASAP the next week and have pretty much been using one consistently ever since. And then the other side of that, okay, what's the downside? That's what physicians are always looking for. And I imagine that conversation just continually comes back to the privacy and security being the consideration. Does that sound about right?
Yeah, absolutely. I think, the questions I get asked again and again, during my clinic visits and my conversations with physicians, and both in the States and also in Canada, and patient privacy, data security, pricing, we probably would talk about that in a minute, and how robust the technology is. And when it comes to guidelines, so what do the regulatory bodies, from CMA and to colleges across provinces, and have done so far? And through my research, actually, the result is quite encouraging. Not surprisingly, many of them have rolled out regulatory guidelines, even though some are interim guidelines for AI technology in healthcare in the past 12 months or so. And if you take a closer look at these guidelines, you see similarities and differences, and where you can really just share with physicians, with medical directors and clinic owners. And similarities, I think across these regulatory bodies, they want to make sure that AI technologies are being used in an ethical and professional way, and especially in a manner that upholds, for example, the CMA Code of Ethics and Professionalism. And they care about patient safety and care. They want to make sure that these AI tools enhance rather than compromise patient care and safety. And they want the vendors to provide some level of transparency and explainability, and so that physicians understand what functions you provide, and what are the limitations, values that you provide, and to their their clinical operations and daily practices. And then there are other dimensions, but they also differ in a couple of significant ways. And one is the scope, and from these guidelines. And so, for example, CPSO, they focus more on efficiency, how these AI technologies would integrate with existing healthcare practices in Ontario, where BC focuses on how we can evolve our standards as AI technology develops, so that we make sure our practitioners stick to the highest possible ethical principles and professional accountabilities. And where, for example, Alberta, they care more about, at least from their initial guidelines, about bias mitigations. How can we maintain, this equitable provision of healthcare across the board? So we can see that the scope and regulatory focuses are different, but still the overall feeling from studying the guidelines and recommendations is that from CMA to provincial colleges, and they are coming out with this balanced approach to integrate AI technologies in healthcare. They recognize the potential benefits of AI scribing, and such as, as we talked about, reducing physician burnout and improving clinical efficiency, while ensuring that these technologies are used in a manner that upholds ethical standards, ensure patient safety, and promotes equity. I think this approach also requires us to collaborate with health authorities, practitioners, and to adhere to the established guidelines and continue to strive for improvements. I think once I mention these to physicians, that help calm a lot of nerves, that we study these, regulatory guidelines and recommendations, And then at the same time, these regulatory bodies are cautiously embracing AI technologies. I think that's an encouraging sign.
Like the considerations when it comes to the different platforms, to me, the efficiency side of things, that's sort of a given, right? Like when we're dealing with a process improvement that's an order of magnitude better than what I was doing last year, I'm kind of like, I'm not even fussed about the nitty gritty of if the tool is 10% better at this dimension and 8% better optimized on this. But the thing that I'm wondering about, as a clinician, is what are the actual ethical considerations here? You mentioned BC is a little bit more focused on the ethics of the implementation of it. From my perspective, I'm kind of like, make sure the patient is okay with you using the tool and seek out the permission to use the AI scribe at every actual encounter. The actual ethical considerations, maybe from the bigger picture that I'm not really privy to about implementing AI in the healthcare space.
Right. Really important question. I think one way to put a framework on this discussion is to think about what are the important actors in this context. And so patients and physicians or providers and their affiliated clinics or health centers, hospitals, and then vendors. I think from the patient's perspective, to uphold a high ethical standard is to make sure that we acquire patient consent. And so the platform Empathia provides a few levels of patient consent just to make the process as seamless, as painless, and efficient as possible. And so we have a comprehensive patient consent that's consistent with the CMA standard, and a clinic can print it out and include that patient consent as part of the patient check-in packet. And then we also have a verbal patient consent where physicians can stop and just at the beginning of an encounter say, hey, I'm going to use Empathia AI scribing solution to help capture our conversation so that I can focus more on you during the encounter. Would you consent? And so that part will get included in the ensuing medical note. And so that's from the patient side. And from the physician side, I think you obviously care about patient privacy and data security. And so we tackle this problem as a vendor now, the third party involved in this equation, from three angles: where the data reside. And so we make sure for us to serve Canadian physicians that we have a dedicated service within the boundaries of Canada. And everything we store, we use the highest medical grade encrypted storage to make sure data is encrypted and can only be unlocked with your login credentials. The second is we gave the flexibility or the power back to you in terms of data retention. So we store three levels of data. Obviously, there's this audio recording, there's the transcript, and finally, there's this computed or generated notes. And so for the recording and the transcript, there's a fixed amount of time and that we store the files for you. And from zero, you get the instant deletion. That means, once the note is computed, the recording and the transcript get deleted instantly and to some certain time period, and then the files will get purged from our system. But the medical notes are there for you to keep, and you get to control when you want to delete them or you want to keep them in your account for a much longer period of time. And then finally, it's the data usage. What do we use the data for? And I think that also can potentially have very significant ethical implications. And we do not use, from the get-go, it's a strategic decision that the company made, that we don't use customer recordings to train our model. However, we do use your notes, your edits, whatever comments you have to tailor our system for you at an individual level. And we also don't use the data to sell or use the data for external commercial purposes. I think from these three angles, in summary, data residency, data retention, data usage, we work with clinics and physicians to make sure we uphold the highest ethical standards and professionalism.
And so it really, I guess when it comes to the ethics of it, comes down to that data security and then the privacy of it. What is this data being used for? In this case, nothing. It just is purely for the end user, and that's it. Is that correct? I'm just considering,
right,
from the clinician's perspective, that seeking the informed consent from the patient when we first have the discussion about like, hi,
Right.
nice to meet you. I'm Dr. So-and-so, and this is part of my workflow and one of the tools. We'll get into it a little bit more with the patient on day 1 compared to day 2 and 3. And so when it comes to that informed consent of like, here, the benefits are pretty obvious, it's going to make my life great. At the same time, I'll be able to pay more attention to you while we're actually interacting. But then the other side of that coin is just like making sure things are really clear when it comes to the data usage and the data storage. Am I hearing you correctly?
Yeah, absolutely. Thank you for the summary. Yes.
Okay, cool. And like, what are the actual standards that a company like Empathia is held to? Specifically here in Canada, because I hear HIPAA
Right.
thrown around all the time. That's kind of like the Kleenex brand of data and healthcare security. But the HIPAA itself is an actual American standard, and
Right.
we can sort of apply it up here in Canada, but that's not the actual letter of the law here. Is that correct?
Right. There's the adaptation of HIPAA in Canada. There's PIPEDA. I think it's the standard issued, and the federal level, and then the provincial level. For example, in BC, you have PIPA, and I think these are all crucial for AI scribing because they set the standards for protecting patient information, and they all similarly require, in a way, the personal health information is collected, used, and disclosed with appropriate safeguards, and ensuring that AI scribing technology is compliant with the stringent privacy and security requirements to protect patient data. And an analogy I often think of is, HIPAA and PIPEDA and PIPA are the laws of the land, and akin to legal system that sets the rules that everyone must follow to ensure public safety and order. And actual implementations, SOC 2, that's a term or acronym we often hear about, which stands for System Organizational Control. 2, on the other hand, can be likened as the security documentation or building code. And so that an organization or vendor like Empathia can, in a concrete and specific way to meet and demonstrate that we are compliant and with these laws and can safely operate our business. So on the one hand, you have HIPAA and PIPEDA and PIPA outline what needs to be done, and the concerns, the standards, and the laws. And then on the other hand, you have the certification, the building codes, and providers to say, okay, specifically, here's what a vendor needs to do. And so we basically take that and we work these specific codes into our data residency, data retention, data usage. And that's essentially how we meet these compliance requirements.
Fascinating. So I've got some more questions on that. Before we get into that, I guess, what's the difference between privacy and security? Because I kind of, in my head, lump it together as just making sure nobody else sees the information. What's the actual...
Oh gosh, it's such a... I mean, we say these words all the time, but...
What does that actually mean, though, when you look at the two independently from another? Is privacy more like your PIPEDA, and then security is more like your SOC 2 compliance? Like
you can't separate the two. I don't think, at least personally, I don't think you can separate data privacy or patient privacy and security in such a black and white way. And again, I think HIPAA, PIPEDA, and PIPA are comprehensive in terms of patient privacy and data security, and the SOC 2 codes are also accordingly very comprehensive. The way I look at it, privacy, in a very simplified way, it specifies who can see the data.
Yep.
Right? Who has a right to see the data. And so that's why the data, privacy also brings encryption to the mix, and the data can only be unlocked with your login credentials, with the right account owner's credentials, and to view the data in clear text or in a readable way. And as data security means how we store the data, and to make sure that the data is not breached and data is not stolen, and it's, if something happens, and immediately we get informed, and there are procedures in place to handle such data breach. And so I think these are, I would say, two sides of the same coin.
Yeah. So I guess privacy, you could look at it from the perspective of like who can just,
Kick
routinely
into, right,
access or get a hold of that information. And I guess that includes with like my, social engineering, right? If a family member is asking me about a patient, that I have permission to talk about, that falls under privacy. But when it comes to like
right,
the bits and bytes and the computer storage of data, now we're
right,
talking security itself.
right, right, right. And sometimes, so for example, one of the fascinating episodes I just listened to when you interviewed one of your recent episodes where you talk about medical record data warehousing. And even when a physician retires and, all the past patient records, how you handle that and whether you can recall the record and give it to the appropriate person or provider so that the person can take over this patient from your panel. And that's data privacy. That's patient privacy, is who can view the data. But also there's security that can the data be safely stored in the mechanism that even a clinic closes or a physician leaves his or her practice, and can the data still be stored in a secure way? And I think these two things really go hand in hand.
Then speak a little bit to the compliance that you as a vendor need to uphold. That's the SOC 2 compliance, right? Like SOC 2
Right.
that we'll see listed on different platforms. What does that actually mean? How does a vendor like Empathia, what does that standard actually look like?
Right. It's challenging. It's challenging. But first of all, I hope to calm some nerves by saying that the benefit of having an intelligent medical assistant that's independent of electronic medical record system, EMR or EHR, is that we don't have to access identifiable patient information for us to compute medically compliant medical notes or pre-charting notes. And imagine, or if you recall, and when you have a conversation or when you are in an encounter with your patients, you don't have to say, hey, Walter, your date of birth is as such, and your social security number is as such, and your patient ID is as such. You just say, hey, Walter, what brings you in today, right? And then we have a normal conversation. I tell you about my issues, and you review, my symptoms. In the end, you give me your assessment and your medical judgment, then we're done. Of course, depending on how detailed the encounter is, we can reverse engineering and engineer and identify who I am, and maybe even trace back to my name, my record. But nonetheless, it's different. AI Scribe solutions is fundamentally different from EMR and EHR. So I just want to put that out there first. But nonetheless, we still want to make sure that we adhere to the highest standards and SOC 2 standards, or the laws that, or the requirements that have been laid out by HIPAA and PIPEDA and PIPA. And again, it comes to these three dimensions. Once you have a framework, it's a lot easier for you to think about these issues or develop a system to do the proper data management. Again, it goes to data residency, where you store your data. And to serve physicians in Canada and the US, we store and process data in medical grade encrypted servers, cluster servers, and within these respective countries. And so that's number one. Number two, retention. I think we gave users control to dictate the retention of encounter recording, the transcript, the medical notes generated by AI, and let them control how long they want to keep those data and when they can delete the data. And then last but not least, the usage of the data. I think we have clear guidance within the company, who can access the customer recordings, and everyone has to go through HIPAA training to make sure that we understand what these regulations entail, and what permissions we need to have to be able to access encounter data to, for example, for support purposes. And last but not least, we want to make sure that we don't sell or use patient data for any external commercial purposes. I think once you have that framework, as the company continues to evolve, we can, get better at sticking to these standards.
any of my patient's data hit your hard drive? I guess like it does SOC 2 and those standards. Does that get all the way into the nitty gritty and down into the weeds of like Walter has to have virus 2024 on his computer to make sure that nobody that's attacking him versus like, the data storage rack at Amazon or at Microsoft? Like, how far down into the actual nuts and bolts of protecting the data do those standards get?
Right. That may be another conversation that gets into the specific requirements or codes that SOC 2 offers. But one thing, just at really high level, maybe more pertain to this conversation, I don't think we store any data locally. Everything is cloud-based and with medical grade encryption. And for serving physicians in Canada, we use a dedicated data server with Amazon AWS deployed in Montreal. And we're also working out an agreement with Microsoft, Azure, and so that we can have data centers across Canada and to give us a more robust service and instead of a single point data center in Montreal. And I think these are some of the things that high level things that we need to do and to make sure that we stick to at least the most important aspects of SOC 2.
Okay, and so everything lives on the cloud. So you're not necessarily doing like penetration testing into like your system. I guess I'm thinking of it from Cherry Health, right? Like we've got the app, and so we've gone through testing where professional hackers are trying to actually like get into our specific software as a user. But I guess that's not really the case with you guys because you log in as yourself and you can't really access other people's data like you can on hardware. It's this network effect. Yours is much more centrally secured with obviously the experts like Amazon.
Right. Not only that, centralized, secured, but also encapsulated. And in the following sense that, an application service and like Empathia, why I say application service is that there's this web-facing or public-facing side of Empathia where people can log on to, for example, Empathia.ai and access their physician portal and see all their notes and their settings, and also use our Google Chrome browser to record and then encounter. So these are the web applications. And the encapsulation comes from where the underlying data storage is actually separated from the application layer. So to the public, they don't even know where our data is stored, let alone any specific instances subject to any cyber attack. So that's, I think, the modern day application server development towards the stack, where there's this very strong encapsulation that from the application server, we have an encrypted way to talk to the underlying data storage. And oftentimes we use multiple storages and for different purposes, different data schema and nature of the data based on, and to choose different storage mechanisms, some, regional database, some NoSQL databases, but everything is encrypted, but also more importantly, encapsulated from the outside. They almost like nameless with no IP addresses or public IP addresses. So that's very challenging for any malicious actors to get access to our patient data, our physician data. And also equally importantly, as you mentioned, by relying on services like AWS, Azure from Microsoft, they have some of the strongest cybersecurity and cloud service security in place, and their detection, real-time detection, is of the highest grade. And so we get alert if anything happens, and so we can take proactive measures very quickly.
You mentioned earlier was that the Empathia is not saving any of the actual data and learning from it, but you did mention when we were first starting to chat that it'll actually like get better as I go on. Do you mean like just from interacting with me, the clinician, and sort of like my customizing of the program, or is that more like the actual LLM model behind the scenes continues to improve? Or what did you mean when you said that it's like literally improving month over month?
So there, the high level, there are at least two main ways to improve an intelligence system. And one is globally. And globally means that we take customer data in our particular case, the encounter data, and de-identify it and use it to fine-tune some pre-trained model, large language model. And I would imagine some of the AI technology companies are doing that. And that's why in their BAA, they would specifically mention that the customer data will be used of course, in a de-identified way, and to subsequently fine-tune and improve their model. And we decided strategically from the get-go that we're not going to go down that path. And however, we do want to build an intelligent system for physicians. So the second path is to do something at the individual level. So you don't fine-tune your model. You don't use the data, the customer data, to train your underlying model, but you construct this site content database where you capture the physician's settings, you capture some of your best notes and some of your templates, macros. So when we try to ask our AI model to generate output, we can better align that output with your personal settings, with your past experiences and domain expertise, your tones even for a note. So for example, you love to write your notes in some positive, encouraging way, in some personal way. We learn from your style, your tone, your medical expertise, and combine that with a new encounter to align the AI model to generate a better output at a personal level for you. That's what I meant. The system evolves for you, but not at a global way, but more at an individual level.
That is very cool. I mean, the same thing is applicable even when we're, training some of our marketing team in terms of tone of voice and some of these like the finer points around the written communication, because it makes a huge difference. And so it really is the application layer that's receiving those improvements.
Absolutely.
And it's not like health data driven. It's more like just how are people actually interacting with the system and using the platform.
And to me, that's more important because you really feel that, the system, Empathia becomes your, personal intelligent medical system, not just some community or global medical system that does things in a very generic way. I think that's important for user experience and also retention.
No, that makes a ton of sense. Okay, cool. And then what about when it comes to the pricing strategy for some of these things? Like I've seen a very broad spectrum of just like monthly fees when it comes to AI Scribe tools.
It's been brutal.
What do you mean when you say brutal from your side of the conversation?
You want to have companies that recognize that this technology has the potential to create so much value for the end customers and also patients indirectly. And so there's a sustainable way of splitting the economic pie created from this technology disruption. But then there's also companies that adopt the philosophy that growth at all costs. And I think Empathia try to adopt our own pricing strategy to make sure that we can build a sustainable and long-term business model. So, if I may recap this in a more cohesive way, if you ask any CFO, they would probably tell you pricing makes or breaks a company, and the right pricing strategy optimizes revenue, obviously, and while fostering the sustainable relationship with your with customers. In this ideal world, pricing would simply be based on the cost to produce, market, and deliver your product and service. However, in reality, as we were just discussing, it's much, much more complex. You have to consider the customer's willingness and ability to pay, and equally importantly, and if not more so, you must contend with competitors that inevitably create this downward pricing pressure, right? And so our approach, like I said, is slightly different from maybe our main competitors, and from two angles. And first, we understand that this AI native product like Empathia fundamentally differs from traditional software as a service SaaS products. Unlike the classic diminishing marginal cost of mass production, once you have the intellectual property developed, and there's a constant marginal cost every time when you compute a note. and it's, support documents such as referral letters, consult letters, after visit patient handouts. In other words, while we aim to stay competitive in pricing, there's this baseline we need to maintain to ensure a sustainable business model. And then the second angle we try to consider is that there's economic value created, and because of the AI technology. And based on the data from our platform, physicians save somewhere between 1.5 to 2 hours a day on documentation. So if a physician, let's say, you have 20 patient seeing days a month, that amounts to 30 hours saved per month. And if we assume physicians bills at $100 hourly rate, and this translates to about $3,000 economic value created jointly by Empathia and the physician. And I think at 150 or 110, depending on the chosen plan, and we capture roughly 5% or less of that value. We believe that's a fair split, and it would also allow us to continue innovating and bringing the best product to market and investing in growing our team.
Ask what it actually costs to run a computation like that. Like, how does that actually work?
It depends on a few. Obviously the context length matters a lot, and if you feed the model with a large chunk of data, and it's going to be more costly. And another dimension is which model you use, right? If you use the state-of-the-art model, it can be more expensive. You use a cheaper and older model, it can be a lot less costly. So there are multiple dimensions for us to consider. But right now, we focus on quality. We focus on quality, and we want to make sure we use the best quality model possible and to get the node right, and then we'll do the cost optimization. So right now we're at probably a few cents per node and, on average. So it's a lot cheaper than even just 6-7 months ago. And I think thanks to the competition, we're talking about friendly competition among AI scribing providers, but there are also friendly competition at a deeper level or at a lower level, where between all the large language model providers from OpenAI to Anthropic to Google and Facebook. I think the competition will drive down the price and while improving quality, and so we will benefit from, because we're customers to the large language model providers, so we'll benefit from their competition, and then in turn, I think our customers, physicians and patients, will benefit from the competition that we face.
Does it get cheaper as the technology gets better, or does it get more expensive because of
absolutely
the
cheaper.
software getting better, hardware?
Yeah, absolutely cheaper. And not only cheaper, also we get faster response time, higher quality inferences. So I think the whole AI technology for healthcare is only going to get better and get better very quickly. All thanks to the large language model providers and the innovations and the continuous improvements that they have put forth.
Does it count as a new computation? Like anytime I make a modification to it, like is that another 10 cents out of Walter's pocket every time I change something? Is that how it works?
Like I said, there's a trade-off between quality and cost. For any given company, and at different stages, we may adjust the trade-off or the prioritization. Right now, we prioritize quality over cost. And so whenever possible, we feed whatever adjustments you hope to make to the model, and to come back with a better version of the node or its support documents. But down the road, I see at least two approaches and to help make costs more effective. And number one is when you just do simple modification of an existing node, you may not need to use the state-of-the-art model anymore. You can use a cheaper model because it's only a very straightforward insertion or modification. Maybe, for example, GPT 3.5 will do the job just fine. And so that's one way. The second, as you alluded to, and we can do it locally. And this is where, natural language processing, some of the earlier techniques can come in handy. So we don't have to do the round trip with large language model. Every time we do a round trip with the large language model, LLM, there's a cost associated.
Because you guys are actually like spending electric energy every time anything happens. It's not like a normal, I don't know, I'm thinking of any of the other software I use. If you download a game or something like that, the cost to the company is negligible. It's like doesn't even matter to have another person sign on, and then you get that economies of scale. You guys are in a way selling goods in terms of compute power.
Right. So we don't get the benefit of having that, as I mentioned earlier, having that diminishing marginal cost. There's actually this constant marginal cost. And with AI, I would say this is not specific to the healthcare industry. I think for any AI native application going forward, there's all going to be this constant marginal cost because we need to compute. And when we need to compute, that means we need to do a round trip with LLM.
From that, then, does that mean if I get charged more from a company for their AI Scribe tool that it's inherently better? That sounds like flawed reasoning.
Trust but validate. I think more higher pricing point does not always translate to higher quality. And I think there's a lot more to how you prompt LLM to better align with your request, how you construct your site content database so that you gave LLM some help. And because it's trained and fine-tuned based on, yes, a large corpus of internet data, but the data may not be specifically for medicine. And also with this much data used to train a large language model, sometimes the large language, just like our human brains, may struggle to find the right information. And so to provide large language model with some help from your site content database could also significantly improve the quality of the output that you get. I think all these things combined determine the kind of eventual quality of the output you get, but not just, I think cost can be an indicator, but definitely not the most significant indicator.
To look at, I guess, but definitely far from the whole picture.
Right. It's a predictor, I would say, but not I don't think anyone has done that study and across the AI scribing solution provider just to see whether the highest cost one is the most the highest quality one. But I think you have to take a more holistic picture and just talk to the team. That's why I think one-on-one onboarding or ground level effort to do lunch and learn at clinics and talk to physicians, medical directors, and hospitalists and hospital administrators, and just to really help them understand the functionalities, the approaches that we take, and how we do the quality control and quality insurance and our product and services. I think all these things are important to justify whatever price you're putting forth.
Before we kind of close things off today, what does the future hold for Empathia here? What from the conversations you're having with all the users at the clinics, the potential users, what are they asking for? And is that, I guess, on your guys' roadmap to start building things as per that?
Right. I think when I travel, I spend so much time flying and in the air and drive from city to city, and I also try to think what's the future for AI technologies in healthcare or AI Scribe more specifically. I don't think it's gonna be as fragmented as the MR market or EHR market, and simply because we don't have the luxury of having very strong physician retention. And EMR really locks physician in, and with all the patient data and patient charts and also the integrations with pharmacy, with insurance companies, and so EMR has very locking effect. But AI Scribe solution providers may not have the luxury of having these benefits, and so I think the market at some point is going to consolidate, and but I think in a way that I can already see three camps of AI scribing solutions that can survive and or even prosper and going forward. One is taking the approach which more like the Android side. It's very flexible, very interactive. It may be a little harder for physicians to adapt to, but once you adapt, it's very powerful. It gives you almost this ChatGPT-ish natural language interaction to do, what you have in mind for it to do. And then the second is maybe the Empathia approach is what I call the Apple approach. And it's very simple, very intuitive, and it doesn't take a whole lot of hand-holding. And with a click of the start to record, and then once the encounter is over, you just click stop, and then the note is there, do some editing, copy to your EMR, you're done, right? And the third camp is the one that integrate with the EMR. And they may have the benefit of getting the patient data and moving the content from AI Scribe to EMR more conveniently, but they also have the downside of facing more scrutiny, because then they definitely have access to identifiable patient information. And also they may not have the comparative advantage to focus just on AI Scribe. So going forward, I see for us to build a defensible business, I see Empathia as a much more than an AI scribing tool. And even though that has been one of our primary focuses, and I envision a future where Empathia, as I mentioned a few times now, to become this intelligent medical assistant for every clinician. And that companionship and assurance of providing this comprehensive medical journal in a non-invasive way and alleviates mental stress and burnout already. And Empathia is that trustworthy, diligent, and patient privacy protector, and upholds at the same time the highest data security standards. And it can be personalized and to appreciate and adapt to your documentation style, tone, as I mentioned, and your medical reasoning and judgment. And it can speak dozens of languages to allow you to focus on patient care instead of searching for an available medical interpreter. And it's always alert and capturing all relevant and necessary medical details, even during hour-long consultations. And it takes instructions just like a human medical scribe with simple voice cues like direct quote and indirect quote. And it can serve as your medical ChatGPT. Look up, the latest guidelines, standards, and medications, but all tailored to the patient at hand. So it's really this omnipresent system that empowering you to focus again on what you do best, which is practicing medicine. But that's where I see the future of Empathia.
This sounds like a glorious vision for the future, and I hope it definitely comes to fruition as described. Because we need a little bit of revitalizing around here.
Yes.
Encompassing tool that just does stuff for you. It streamlines and creates notes, creates forms and templates, and does the follow up for you. That's sort of like the dream for AI in general, not just in medicine, but like how it works for your lawyer,
as
how
a
it
co-pilot.
works for your exactly.
Absolutely right.
Okay, well, final question, Walter. What is your secret to wellness? How do you actually keep yourself going?
I actually had a conversation with an internist and not too long ago, and I think we share some. We have some commonalities, and number one, I love to use my brain, and as much as I can, and the brain needs workouts as much as our muscles do, and I enjoy meeting people, and working in the field gives me tremendous utility, and I think it keeps me healthy mentally, emotionally, and I still get hugs from time to time from physicians. Thank Empathia for giving their lives back. And I still get goosebumps when I walk into a clinic where I run into physicians for our customers. And I think that's all an essential part of my mental health. And I work out and as much as I can. But there's also this side of brain science, which I think is applicable to my line of work, where I spend so much time in the field, is that all moment. A few weeks ago, I was in Nova Scotia, and I landed in Halifax. I drove down to Bridgewater, and then I went up north all the way to Glace Bay. And during that drive, we probably cross 1,500 kilometers, and just to see the nature, see the bay, see water and the trees, forest, and these owl moments reset your brain and give you fresh perspective on life, on work, and I think all these things collectively keep me well.
I think you're
I
onto
hope that
something
makes
there.
sense.
Yeah. Oh, yeah. I know if you're lacking any of that mental stimulation, working in the computer science field, and I think you're hitting the nail on the head. Sometimes you got to take some time to just go and look at a rock, admire it.
Absolutely.
Incredible. Okay, Walter, thank you so much for taking the time to chat today. Really appreciate it.
Absolutely. Thank you so much, Dr. Jordan. I really enjoyed it.